Okay, let's talk about it. When your kid gets sick, the whole world just stops, right? Suddenly, you're the nurse, the chef, the comforter, and it can be a lot. So we're going to cut through all the noise and give you a clear, practical guide to get you through these tough moments with confidence.
Oh yeah, we've all been there. It's the middle of the night, your child is hot or coughing, and you're just endlessly scrolling online, finding a million different opinions. The worry is so real, and trying to find an answer you can trust, it's just exhausting.
And that's exactly why we're doing this. We've boiled down all the key information from pediatric experts to give you a straight-up, step-by-step guide. No fluff, no conflicting advice, just the answers that matter, so you can get back to what's most important, taking care of your child.
First things first, let's talk about what you can do right now at home. These are the basics for managing those common symptoms and just making your little one as comfortable as possible while their body does its thing.
You know that awful hacking cough and stuffy nose? Well, moisture is your absolute best friend here. A cool mist humidifier in their room, or even just a simple saline nasal spray can really help. For babies who can't blow their nose yet, that little nasal aspirator is a lifesaver. And of course, the simple stuff. Coughing into an elbow, washing hands constantly, is so key to stopping the germs from making the rounds.
Ugh, a sore throat is just miserable. The strategy here is to think soft and cold. Things like frozen yogurt, smoothies, or popsicles feel so good going down. And here's a great little tip. For kids over 1 year old, a small spoonful of honey can actually do wonders to soothe their throat and cough. But really, the #1 priority is hydration. Even tiny, frequent sips of water make a huge difference.
All right, this is the big question every parent asks. Is it just a cold, or is it the flu? The symptoms can look so similar at first, but figuring out which one you're dealing with is really helpful. So let's break down the difference.
So here's the main tell, according to the CDC. Think about how it started. A cold usually creeps up on you, right? A sniffle one day, a little cough the next. The flu, on the other hand, hits like a freight train. It's sudden, it's intense, and it usually brings along those awful body aches, chills, and a kind of exhaustion that just completely wipes your child out.
Okay, let's talk about the one thing that sends a parent's heart rate through the roof, a high number on the thermometer. There's even a name for this, fever phobia. But what if we've been looking at fever all wrong? Let's totally reframe this.
I love this quote. It's from way back in the 1600s, but it is so spot on. It paints this picture of fever not as the sickness itself, but as the body's own powerful weapon for fighting that sickness. Fever isn't the enemy, it's the superhero.
And the science totally backs this up. A fever actually supercharges your child's immune system. It creates this hot environment that viruses and bacteria just hate, slowing down their ability to multiply. So here's the big takeaway. The goal isn't to chase a number on the thermometer. The goal is to make your child comfortable. How they look and act is so much more important than what the screen says.
Now, if your child is just plain miserable, of course, medicine can be a huge help, but you've got to use it safely. Acetaminophen is typically okay for babies over 3 months old, and ibuprofen for those over 6 months. And listen, this is the most important part. The dose is always based on your child's current weight, not their age. Always, always check the label for the correct weight-based dose.
So you're doing all the right things at home. You're comforting them, you're managing the symptoms, but how do you know when it's time to call in the professionals? Let's walk through the exact signs that mean you should pick up the phone and call the doctor.
Okay, here are your big clues. A fever that sticks around for more than 3 days is a definite reason to call. Same goes for a fever that disappears for a day and then comes roaring back. And just trust your gut on their behavior. If your child is so irritable that absolutely nothing you do can comfort them, that's a sign that you need to check in with their doctor.
Now, this is a really cool tool that you can use, and you don't need any fancy equipment. You can actually check your child's breathing rate right at home. It gives you a real, concrete number that tells you just how hard their little body is working to breathe.
So, for a baby under 1 year old, the magic number is 60. When they're calm and resting, not crying or anything, just count how many times their chest rises in 1 full minute. If that number is consistently over 60, it's time to seek help. And for a toddler or a preschooler, so from ages 1 to 5, that number changes to 40. Same rules apply. Measure it when they're resting. If their breathing rate is staying above 40 breaths per minute, that's your signal to make the call.
All right, we need to shift gears here, and I need you to listen closely. The things we're about to talk about are not wait-and-see symptoms. These are not call the nurse line symptoms. These are true red flags that mean you need to get to an emergency room right away.
First, look at their overall energy level. We're talking beyond just being tired from being sick. If your child is listless, seems incredibly weak, or feels kind of floppy in your arms, that is a serious sign.
If you're having trouble waking your child up, or if they seem unusually sleepy and are hard to rouse, that is an emergency.
This is one of the most important things to watch for. I mean, really watch their chest. Can you see the skin sucking in between their ribs with each breath? Or see their little nostrils flaring out? That means they are working way too hard to breathe and need help now.
This one is unmistakable and means you need to call 911. If you see any kind of bluish or purplish color around their lips or on their tongue, it's a sign they are not getting enough oxygen.
And here are a few other critical red flags. For an infant under 3 months, any fever is an emergency. No wet diaper in over 12 hours is a sign of serious dehydration. Any kind of seizure-like jerking, being totally unresponsive, or if they're drooling because they can't even swallow. Any of these mean you go straight to the ER.
Okay, we have covered a lot. Comfort, symptoms, fevers, and some really serious red flags. So after all the numbers and the lists, what is the single most valuable tool you have when your child is sick?
It's you. Seriously, you are the world's leading expert on your child. You know their normal cry, you know their normal energy, you know them. If your gut, your intuition, your parent sense is screaming at you that something is really truly wrong, you need to listen to that voice. It is your most powerful tool. Trust it.